Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, the next type of cortical cataract is next type of senile cataract. The senile cataract can also be one more type. Senile cataract can also be cortical cataract. Okay, so in the cortical cataract we have here, in the cortical cataract, number one, there will be decrease in total proteins, amino acids and potassium will be decreased first. There is decrease in total proteins, amino acids and potassium. Along with that, the patient will also have increased concentrations of sodium are seen in the patient. Whenever there is decreased proteins, amino acids and potassium, and there is increased concentration of sodium, this sodium will bring the water inside the lens. So there is increased water, so there occurs hydration of lens occurs. There is hydration of lens will occur along with the coagulation of proteins. Hydration of lens occurs with coagulation of proteins will occur in senile cataract. So senile cataract can be of two types. One, we have a cupuliform cataract is seen. In the cupuliform cataract, we will see presence of radial spokes or radial spokes are seen, whereas one cuneiform cataract, in cuneiform cataract there is radial spokes are seen, whereas cupuliform cataract is actually a posterior subcapsular cataract. So if you see, these are the radial spokes which are seen. These radial spokes are seen in cuneiform cataract, whereas we also have cupuliform cataract. Cupuliform cataract is the posterior subcapsular cataract which looks something like this. So these are the radial spokes in the cuneiform cataract, and these are the posterior subcapsular cataract in cupuliform cataract.
thank you and thank you for watching.